Welcome to this presentation about the independent report of findings from the NHS Mid and South Essex Integrated Care Board Community Capacity Consultation, which took place from January to April 2024. This is a summary of the findings. The full report is published on the ICB's website. It should be read in conjunction with the draft report of the public consultation hearing, which is published in the same place. NHS Mid and South Essex Integrating Care Board, or MSEICB, is the organisation responsible for planning and paying for NHS health and care services for the 1.2 million people living across Mid-Essex, South East Essex, Basildon and Brentwood, and Thurrock. From the 25th of January to the 11th of April 2024, MSEICB held a public consultation focused on some community hospital services in its area provided by Mid and South Essex NHS Foundation Trust, Essex Partnership NHS Foundation Trust, Provide Community Interest Company, and North East London NHS Foundation Trust. This presentation sets out a summary of the public consultation activities and the independent analysis of the feedback received. The matters set out in the published consultation were proposals for potential changes to the places where some community hospital intermediate care and stroke rehabilitation services are provided. A proposal to make permanent the temporary move of the freestanding midwife-led birthing unit in Mid and South Essex from St Peter's Hospital in Malden to the William Julian Coulthard unit at Braintree Community Hospital. And a request for feedback on the possibility of moving all other patient services at St Peter's Hospital in Malden to other locations mostly in and around Malden. A consultation document and a range of supporting and accessible information was produced and published online and in print. The consultation was promoted to invite the public to find out more and get involved by giving their views. People who live and work in the area and who use or might use the services were invited to respond to the consultation in a range of ways. By attending one of a series of 10 scheduled consultation events, presenting at or attending a public consultation hearing, running or attending an event or focus group run by a partner or community organisation, completing the consultation survey online or on paper, or getting in touch to provide a response by email, by post, or over the phone. There were 5,544 individual responses to the consultation survey. 310 people attended MSEICB consultation events. 407 people attended staff meetings. 61 people took part in focus group sessions organised by partners and community groups. 17 additional long-form written responses to the consultation were received. 14 individuals, groups, and community representatives presented at one of our consultation hearing sessions. More than 100 people observed those sessions in person and online, and the recordings on YouTube have been viewed more than 1,000 times. On the website, there were 20,000 page views. The consultation was covered by 216 stories in the media. MSEICB social media posts related to the consultation received over 1,000 engagements. And there were 577 attendees at other consultation events organised by partners, including an estimated 400 at the Plume Academy in Malden for the public meeting organised by Sir John Whittingdale OBE, the MP for Malden, and there were 1,108 responses to an additional consultation survey organised by Sir John. 71% of respondents to the consultation were from Malden District. Smaller proportions were from Chelmsford, Braintree, Brentwood and Southend-on-Sea. 1% or less were from Colchester, Basildon, Rochford, Castle Point and Thurrock. People between 55 and 74 years old were most likely to respond. 907 people over the age of 75 responded. 1,175 of our respondents were under the age of 45. More than 9 in every 10 respondents identified as white British. 3% identified as another ethnic group. Nearly all spoke English as their main language. 23 people speak a language other than English. 2/3 of respondents are women, 1/4 are men, 10% chose not to disclose their gender, and less than 1% stated that their gender identity did not match their sex at birth. Most respondents identified as heterosexual, with 1% identifying as lesbian, gay, or bisexual. 5% were currently pregnant or had given birth in the past year. 42% reported having a long-term physical or mental health condition with varying impacts on daily activities. Participants were generous with their feedback on the consultation process. This is a selection of the points received. These issues and other points of feedback are described in the draft consultation report, along with actions that were taken to address them. Alternative suggestions included reconsider closure and explore refurbishing or rebuilding St Peter's Hospital. Consider new premises or purpose-built health facilities to house outpatient and other services. Make sure locations are accessible and have adequate space for the services that need to be together. General comments included St Peter's Hospital is at the heart of Malden, providing essential services to local residents. Participants reported that the consultation has generated significant upset, uncertainty, and anger among residents and staff. Participants described their frustration about perceived mismanagement and lack of investment in St Peter's Hospital. Many believe that financial decisions are being prioritised over patient needs and that proper maintenance could have prevented the current situation. Distrust is prevalent, with many referencing unfulfilled promises of a new hospital or health hub in Malden. Many believe that with sufficient NHS and government investment, St Peter's Hospital could be refurbished or rebuilt, allowing temporarily relocated services to return and other services to be added. If the hospital is sold, it is considered crucial proceeds be reinvested to improving health services in Malden, such as building a new hospital or health hub. Specific locations for this were suggested. A full list of the issues raised and suggestions made are included in the draft consultation report. What happens now? Mid and South Essex Integrated Care Board is publishing the draft consultation report and the draft report of the public consultation hearing. Both reports are available on the Virtual Views website. Residents and stakeholders, particularly people who took part in the consultation, now have the opportunity to review the draft consultation report and comment on the findings and propose next steps if they wish to. An online feedback session has been organised to take place on the 18th of July at 6:30 p.m, where people can hear directly from the analysts who drafted the report. You can sign up to attend that event on the Virtual Views website or by calling the consultation office. The 14 people and groups who presented at public consultation hearing sessions are being contacted directly and invited to check that the draft report accurately reflects their presentation. We'll now look at the findings in regard to each of the sections of the consultation, starting with community hospital intermediate care and stroke rehabilitation beds. The consultation set out two options. Option A proposed a 50-bed stroke rehabilitation unit at Brentwood Community Hospital with 22 intermediate care beds at Cumberledge Intermediate Care Centre, Rochford. Option B proposed 25 stroke rehabilitation beds and 25 intermediate care beds at Brentwood Community Hospital. It proposed 22 stroke rehabilitation beds at Cumberledge Intermediate Care Centre in Rochford. Both options included 20 intermediate care beds at Halstead Hospital, 22 intermediate care beds at Mount Snessing Court, Billericay, and 24 intermediate care beds at Thurrock Community Hospital in Grays. Neither option included inpatient beds at St Peter's Hospital in Malden. 2,269 people responded to survey questions about stroke rehabilitation and intermediate care inpatient services. The majority perceived both options as very poor or poor solutions, with greater concern for option A. 89% rated option A poorly, 77% rated option B poorly. Only 5% considered option A good, while 16% favoured option B. When asked which option they prefer, 5% chose option A, 18% chose option B, and 78% chose neither option. All age groups predominantly selected neither option, especially those aged 75 plus. There was slightly more support for option B among those aged 25 to 54. Women were slightly more likely than men to state a preference for option B. Those identifying as from an ethnic background other than white British showed slightly higher support for both options, particularly option B. People who are more financially stable were more likely to prefer option B than people who are less financially stable. Those without physical or mental health conditions showed more support for option B than those with health conditions. Overall, the preference leaned significantly towards neither option. The majority of respondents from Malden, Chelmsford, and Braintree rated both options poorly. Residents of Brentwood and Southend-on-Sea rated option A poorly, and on balance, preferred option B. The samples from Rochford and Castle Point and Basildon are too small to rely on. 117 staff and clinicians responded to the survey. 72% rated option A as a very poor or poor solution, while 19% saw it as a very good or good solution. In comparison, 32% rated option B poorly, 53% considered it a good solution. 53% of staff and clinicians preferred option B in the survey. Option A was preferred by 16%, and 31% preferred neither option. In consultation meetings, staff expressed mixed opinions about the proposals, with more support for option B among Cumberledge Intermediate Care Centre staff. Reasons for objecting to both options. Over half of respondents, 59%, cited concerns about increased travel for support networks, including the cost, poor public transport, parking difficulties, added stress, pollution and inconvenience, potentially leading to patient isolation and poor mental health. 36% opposed both options, citing lack of local healthcare provision, stressing the importance of St Peter's Hospital and the need for continued inpatient services in Malden. 17% pointed to growing and ageing population needing more services, not fewer, especially in the light of housing developments in the area. 3% expressed frustration and distrust, feeling that decisions were financially driven rather than patient-centric, with unmet promises of new services in the past. Participants gave a range of reasons for supporting or objecting to the proposals. For option A, support included recognition of the benefits of having a specialist stroke rehabilitation facility, more beds, adequate staff and facilities at Brentwood Hospital, and that St Peter's Hospital is not fit for purpose. Reasons for objecting to option A included concerns about access difficulties for family members and the health and mental health impact that would have on patients through isolation. There were concerns about staff travel issues, the loss of intermediate care beds for Brentwood residents, significant staff changes, and implications of centralised services. For option B, support included that there's more local care in the proposal, reduced travel time for visitors over option A, and that it's better for Brentwood residents with a mix of stroke rehabilitation and intermediate care beds. It was also seen as a better solution or compromise, especially for Southend-on-Sea and Rochford residents. Reasons for objecting to option B included concerns about the capacity of community services to support patients without intermediate care beds at Cumberledge Intermediate Care Centre in Rochford, and the level of therapy input needed given current vacancies in occupational therapy. Consultation findings. Location of the freestanding midwife-led birthing unit. The consultation option. The consultation document set out one option for a freestanding midwife-led birthing unit for the people of Mid and South Essex to be based at the William Julian Courtauld, or WJC, birthing unit in St Michael's Health Centre at Braintree Community Hospital. The document stated that this option would mean eligible people would have the choice to travel to Braintree to give birth, supported by their midwives. Where there are complications that need hospital support, patients would transfer to Broomfield Hospital, Chelmsford. The impact of the proposal would be that the freestanding midwife-led birthing unit at St Peter's Hospital in Malden would be closed permanently. 2,433 people responded to the survey. 94% of those rated the option as poor or very poor. Among the 66 staff and clinicians who responded to the survey, 90% rated the proposal as very poor or poor. Only 5% viewed it as very good or good. The highest objection rates were among respondents from Malden, Colchester, Chelmsford and Braintree. The lowest objection rate was in Southend-on-Sea, where still 3/4 of the respondents rated the proposal poorly. There was slightly greater dissatisfaction with the proposal among people who are white British compared to those from other backgrounds. Nearly all the respondents who were less financially stable rated the option poorly. There was no difference in terms of gender, age, presence of physical or mental health condition, and whether respondents were currently pregnant or had just had a baby in the last year. A small proportion, 3%, of survey respondents supported the proposal. Reasons given for support through the survey and other consultation activities included that WJC is a newer, fit-for-purpose facility that is staffed at all times. A view that St Peter's Hospital is not fit for purpose and faces financial constraints. Some shared negative experiences of St Peter's Hospital. Some thought it a better option for Malden residents, improving access, and some saw advantages in WJC's proximity to Broomfield Hospital for handling complications and the potential to improve outcomes and midwife confidence. Reasons given for objecting to the proposal. 75% of respondents raised increased travel and access difficulties as the key reason for objection. Their concerns included lack of or poor public transport, poor road infrastructure, the costs of travel, parking difficulties, pollution and environmental impact, the pain, distress and increased risk when travelling longer distances in labour, especially if transfer to another hospital is needed, inconvenience, and how time off work would affect income, concerns for those without access to a car and living in remote areas like Burnham-on-Crouch. 38% of people were concerned about reduced birthing options due to the closure of St Peter's Hospital. Their reasons included that St Peter's serves a large geographic area and is highly valued for its exceptional care and home-like birthing experience. 16% of respondents stressed the need for more services due to a rapidly growing population, and 8% of respondents told us about their concerns about capacity at the WJC and Broomfield Hospital, and the potentially negative impact that would have on quality of care, quicker discharges, and postnatal breastfeeding support. Consultation findings on the possibility of moving all other services at St Peter's Hospital to other locations in and around Malden. The consultation asked for feedback on the idea of permanently moving all the other services at St Peter's Hospital to other locations, mostly in and around Malden. The consultation document set out that the age, condition and suitability of St Peter's Hospital means the ICB is thinking about the need to provide alternative accommodation for the other services provided in Malden. 4,447 people responded via the consultation survey to the request for views on what the ICB should take into account before it makes a decision to move all services from St Peter's Hospital. The vast majority of respondents considered the idea to be very bad or bad. That sentiment was highest in Malden, followed by Chelmsford and Braintree. The sentiment was lowest, though still very high, in Colchester. Only 3% felt it was a very good or good idea. People who are less financially stable were more likely to rate the idea as very bad or bad. 16 to 24-year-olds were most likely to rate the idea as very bad or bad. There were no significant differences in terms of gender or presence of physical or mental health conditions. Of the 71 staff and clinicians who responded to this part of the survey, 81% rated the idea as very bad or bad. 11% rated the idea as very good or good. Reasons given in the survey and through other feedback gathered in consultation activities included travel and access difficulties, including costs, parking, pollution, poor public transport, road infrastructure and inconvenience. Participants' views included that there would be reduced appointment attendance and the attendant impact, especially for elderly, vulnerable and rural residents. The potential closure of St Peter's Hospital was cited by 42% of survey respondents. Participants shared concerns including the loss of a vital resource and the need for local outpatient services before closure. The need for more local services was raised by 22% of survey respondents. Increased demand for an ageing population and large new housing developments in Malden District were regularly raised in discussions. 17% of respondents valued the hospital's convenient location with all services under one roof. 16% voiced concerns about increased pressure on other services, hospitals, GP practices, and the ambulance service. Participants were generous with suggestions for possible locations for a new build facility and suggestions for alternative premises which might be suitable as accommodation for some of the other services currently provided at St Peter's Hospital. This is a selection of those suggestions. The full list is in the published report. For more information about the consultation and to find the published reports, please visit virtualviews.mid&southessex.ics.nhs.uk. To comment on the draft consultation report, please email nhsconsultation@wearestand.co.uk or write to Stand, Enterprise House, Barnard Castle, DL 128XT. Comments must be received by the 31st of July 2024. Thank you for watching.